Welcome back, and thanks so much for staying on Sunrise Live on E! Now, there are different systems in place used by students to study. Our focus this morning is how to best prepare for examination, study tips and ways to improve your memory. In most cases, students have severe headaches, and other people, of course, but this might be due to lack of time to prepare for an exam, and then we resort to drugs and medication. Now, all this can be alleviated if people focus on the way to improve their memory by studying in time, taking study breaks, and explaining to yourself repetition, discussing important topics with a willing classmate, and, of course, taking better care of your health. To further discuss this, we're joined by Dr. Elliot Shevel from the South African Headache Society. Dr. Shevel, thanks so much for making time this morning.
Good morning.
It's amazing that you can run a complete industry just on headaches alone.
Cindy, as I mentioned to you, headaches are the most common affliction of the human race. So a large percentage of people from all walks of life and all, whether they live in cities or on a farm or whatever, suffer from headaches.
Yeah, but there are those that you can pretty much ignore because, you know, some people just don't medicate for headaches or they don't get headaches. How's that?
Certain people are more prone, there's a genetic element, and if you are prone to getting headaches, if you're prone, say, to muscle tension, then many things can trigger it off. For instance, if you aren't sitting properly in front of your computer, if your posture's not right, when you're studying, certain drugs that are taken during studying, by drugs I mean caffeine in coffee and in mineral drinks, can lead to headaches as well. So one has to, if one can control those sort of things, one can minimize the headaches. But that's a short-term answer. The long-term answer is to find out why that person is prone to headaches. And it's possible now with the advances in headache treatment and diagnosis that we've made. What we do at the headache clinic, we find out where is the pain coming from. You know, caffeine might lead to headaches, but caffeine doesn't hurt. There's got to be a structure somewhere where the pain is coming from. When we can find that structure and treat it, then you get a long-term benefit.
Yeah, and we're not talking about severe headaches here. We're talking more about tension headaches or anxiety if you are stressed at a particular time with mid-year exams coming up. What are the different types of headaches?
There are some classifications. They say they're tension headaches and migraine, but they really are the same thing. It just depends how severe the headache is. The more severe it is, the more they call it migraine. The less severe, the more they call it tension headache. But one still has to find the underlying cause and treat the underlying cause, and then you don't get the headaches anymore. Yeah,
because you're suggesting that there could be misdiagnosis, especially if somebody says I suffer from migraines, you'd find that it's an unrelated ailment that could be treated.
You have to find the cause. As I said, there are two major causes that we can treat, and that is muscle tension around the head and neck. That's probably the most common cause of tension and migraine headaches. And the other cause is pain from the arteries in the scalp of the branches of the external carotid artery. And these can be treated. We've made some wonderful advances here in South Africa in the last couple of years on surgical treatments for these problems, non-surgical treatments. We can treat, there are many ways to treat muscle tension, depending on where the pain is coming from. We use microsurgical techniques to find the trigger points in the muscles, and we can treat those, and that permanently gives one relief.
Yeah, but the tendency to just use over-the-counter medication may not necessarily be dealing with the problems or the symptoms effectively. It could be a temporary solution to it, to a bigger problem.
It's a temporary solution, and the problem with medication for headaches is it leads to what they call medication overuse headache. If you have to take these medications regularly, the headaches get worse and worse and worse, and you take more and more and more drugs. So and as a community service at the Headache Clinic, we will provide anybody who wants to phone in or get onto the website with headache diaries so that they can check and see if there are any foods or how the foods are related to their headaches, how their headaches are perhaps related to staying up late studying. We can provide diaries. We can provide information on how to sit the correct posture in front of the
because
the computer.
Yeah. And not taking anything away from the audience or undermining their intelligence,
Yes.
but I don't know if everybody literally studies the content or the effect of the over-the-counter medication that they use, and whether it's toxic, and how long you should be taking it for and the impact thereof.
Well, the problem is that most of the medications don't really warn people that they can cause rebound or medication overuse headache. If it was up to us at the headache clinic, we would have them put on every box of over-the-counter and, in fact, prescription medication that is used for headache, that this can be dangerous to your health, just like the cigarettes, because it can. It leads to more and more medication taking, headaches get worse and worse, and it's a downward spiral. But fortunately, if we can diagnose what the real underlying cause is, people can get rid of their medication. We believe in drug-free treatment.
Yeah, but I mean, don't we inherently have cognitive skills, or we have the ability to solve problems and can rely on ourselves to deal with the anxiety and the stresses of having to study and work and all sorts of things without having to medicate?
It's impossible to get rid of the stresses of life. If you're studying, no matter how well organized you are, you'll still be stressed to a certain extent. But certain people are stressed from studying or whatever, and they don't get headaches. And in others, the stress is a trigger. That's why, if you look at the problem from a multidisciplinary approach, in other words, if you look at it from all angles and find out which structures in the head and neck are causing the problem, and treat those underlying structures, people that are no longer, when they have stress, it no longer triggers a headache. When they eat certain foods, it no longer triggers a headache.
All right. No, we'll get the website address from you in a while, Dr. Shevel, but thanks so much for coming through this morning.
It's a great pleasure.
We appreciate it. We're speaking to Dr. Elliot Shevel from the South African Headache Clinic. For more information, visit Headache Clinic or headclinic.host.co.za. Head.host or head. All right, I'll get it right in a while. Let's take a look at a trivia quiz question for this morning.